Welcome to the Smart Podcast, where healthcare meets hustle. Each week, we bring you inspiring stories from nurses who've turned their clinical expertise into thriving businesses, innovative startups, and impactful ventures. Our guests share insights, challenges, and triumphs of merging compassion with commerce. Whether you're looking to elevate your nursing career or embark on an entrepreneurial journey, the Smart Podcast is your go-to resource for motivation and actionable advice. Tune in and transform your passion for care into powerful catalyst for change. Welcome to the Smart Podcast, where healthcare meets hustle. Each week, we bring you inspiring stories from nurses who've turned their clinical expertise into thriving businesses, innovative startups, and impactful ventures. Our guests share insights, challenges, and triumphs of merging compassion with commerce. Whether you're looking to elevate your nursing career or embark on an entrepreneurial journey, the Smart Podcast is your go-to resource for motivation and actionable advice. Tune in and transform your passion for care into powerful catalyst for change. Welcome to the Smart Podcast, where healthcare meets hustle. Each week, we bring you inspiring stories from nurses who've turned their clinical expertise into thriving businesses, innovative startups, and impactful ventures. Our guests share insights, challenges, and triumphs of merging compassion with commerce. Whether you're looking to elevate your nursing career or embark on an entrepreneurial journey, the Smart Podcast is your go-to resource for motivation and actionable advice. Tune in and transform your passion for care into powerful catalyst for change.
One day when I came from bathing in the bedroom, I was applying lotion. That's when I just saw something popping like a balloon. Immediately I started chemotherapy. First day, I even fainted. I said, Doctor, I've seen people in stage 4, their breasts are cut. Why can't you just cut it at now? Stage 4, we cannot do anything. Yes,
And that drug was given to you for
Anastrazole. Yes.
free? It was given to you for free?
Nima.
You stopped going for review?
Yes, I stopped. I started working in 1997. Maybe you've experienced such. In all places they work. They are not paperwork nurses. No, they are hands-on nurses.
Not paperwork nurses?
No.
We even have paperwork nurses.
Registered nurses. They are paperwork nurses. But like our friends, the registered nurse, when they reach in the office, in the ward, they will salute. Their work is timetable. 2000, I was seconded to UN. And then me, I didn't know Swahili. So I had to learn Swahili. And I was given a clinic in Dundumwezi. I went there to Dundumwezi. I worked just a year. It was a bush. Alone, a nurse, Kanyumba for a nurse, just down there alone. It was very scary.
In Dundumwezi?
Yes, so do so much. No husband. Which husband can accept such? And this breast cancer, let me even mention, even men are having it.
Welcome to the Smart Podcast, your number one podcast. Of course, this is a podcast where we share inspiring stories that are there to trigger your thoughts and, of course, to inspire you, motivate you, and keep you going even in the complexities of life. Joined by Tendai as always. Tendai, good to see you again for the second time this week. How has been your week?
It's been okay. I can't complain.
Okay. You look sad.
I'm hungry.
No, I'll take you out for lunch, don't worry.
You can manage my budget.
What's your budget?
We'll talk later.
Yeah, if you can pay half of the bill, will be okay.
Why would I pay half of a bill when I'm with a man? Okay, let's dive in the podcast.
Yeah, so among women, we quite have a number of over 1,000 actually in Zambia yearly. Women having complications. Well, of course, with regards to breast cancer. And today in the studio, we are privileged to have one of the victims who has been struggling or battling with breast cancer for the past few years. And this is one of the diseases, rather. Is it a disease? No? Is it?
It's a disease.
It's a condition. Yeah, it could be a condition or a disease that's on when you are doing statistics, will tell you that women, of course, die from cervical cancer yearly, or breast cancer rather yearly, and of course many survive. But what is the better treatment? What are some of the early stages? What should you do for you to remain in good treatment? We are privileged today to host Tendai, one of the victims, one who is battling breast cancer, which is mostly popular in you women.
Yeah, it's one of the popular cancers that's so far. I feel cervical cancer and breast cancer is one which is very common. And sometimes it goes unnoticed among a lot of women. I believe there's need for more education on some of the signs and symptoms that one should look out for in breast cancer and cervical cancer. And today we're joined by Monica Banda, a breast cancer warrior. Hi, Madam Monica. How are you doing?
I'm fine. And you, how are you?
I'm good. It's good to have you at a Smart Podcast today.
I'm happy to. Good to have you too.
So this Smart Podcast is sponsored by Elitrasmart Limited, the #1 medical supplies limited. We believe a cleanness is a happiness, hence we always preach about wearing our brand as Elitrasmart Limited. Our brand is best known as Waitoto and Blue Toto because nurses are supposed to be smart. When you're smart, you have the confidence. Yes, Mr. Kalava?
No, I'm looking at you, I'm smiling, I'm like, oh wow. Where's your at the Blue Toto?
Blue Toto and White Toto. I think you can even see we have some here with
quite
us.
amazing designs.
Yes.
Yeah, and the Elitrasmart were also interested in the professional development and personal development of people, actually. And we take note of most people when things are happening around, especially in the health sector, graduations, ceremonies, indawas, as it were. And I think it was during the time of the graduation of the recent nursing and midwives ceremony that we identified our guest today. Yeah, and so thank you very much for joining us. We thought it would be best for us to share your experience so that the rest of the people could learn from how you are battling with this. But maybe from starters, even before we speak about your condition, how did you find yourself in that on that graduation of nurses and midwives?
Okay, I was found there because I was abridging. I'm an enrolled nurse. I was an enrolled nurse. Mm-hmm. Yeah, that is the certificate in nursing. So this time around, they are phasing out enrolled nursing. There's nowhere you can find a job as an enrolled nurse. Even the adverts, there is nothing that nurses enrolled nursing. So all along, I wanted to abridge. Mm-hmm. But I had other things that I was doing, like I was taking care of my siblings who were going to school, and my parents were unable to take them to school. By then, he had already retired. Mm-hmm. So I couldn't go for in-service. By then, it was in-service. I couldn't go for in-service because I was trying to help my sisters. Yeah. So after I saw that at least they all had something to do, then after some years, I thought I can abridge. Yeah. Mm-hmm. So, and I had some chances working in organizations where maybe they wanted RN to work, the position of RN, but as an enrolled nurse, I had that chance to work in those positions. Mm-hmm. Yeah. So now that inferiority complex, you've been given a position of a manager and you are an enrolled nurse, and then you are spearheading the registered nursing.
Mm-hmm.
It was really a challenge.
Mm-hmm.
But
The ones who have more papers than you.
Yes, but I stood firm. Yes, I stood firm. I said, they know why they put me here, so let me work.
Mm-hmm.
So even though when I go home, I still used to think about it. I just said, no, I just need to upgrade. Yeah. So that's how in 2021, I enrolled with the Defense School of Health Sciences.
Mm-hmm.
Yeah, Defense School of Health Sciences. When I enrolled, I did the first attempt. I failed. I failed one subject. Then from there, I couldn't continue because I discovered that I had this condition. Yes. Now, for me, going to the clinics, I do tests, what and what. So it was difficult for me to continue with school.
Mm-hmm.
Yeah, so I concentrated with it, my health. So that's how I started going for tests and examinations until at last they discovered that it was cancer. Yeah, and they staged me 4. But like when I went there, they said I had gone late. But for sure, it was not late. For me, it was not late because I had no signs and symptoms at all. Nothing was showing. I was just okay.
Mm-hmm.
Yeah, it was just one day when I came from bathing in the bedroom, I was applying lotion. That's when I just saw something popping like a balloon on my left breast. I looked at it. It was soft. It was not hard. I looked at it. I thought, being a nurse, I started thinking, as nurses, I started thinking, what's this? Okay, I continued. I applied the lotion. Then I went outside. I couldn't share with my twin sister. I just forgot about it. But I shared with her best friend because she had cervical cancer.
Okay.
Yes. And she underwent all the treatment, and up to now she's there. It's
Okay.
about 10, 15 years now.
Oh.
So I shared to that lady. And then she told me, no, you know what, Monica, you need to go to the hospital. Then I told her, I wanted to write in November. So if I say I go to the hospital and I'm found I have cancer, I won't concentrate a night film. But she insisted. So that's how I went to the hospital. When I went to the hospital, I was seen. First, I went to Levi Manawasa Hospital.
Yes.
There at cancer, what? That area where they screen cancer.
Yes, cervical
patients,
cancer
yes.
screening.
Yes. So, in the past, I heard they were doing it, the breast cancer screening at first level, Matero.
Mm.
Then they shifted to
Levi.
UTH. So I went to Levi. So when I went there, I was called. I entered in the room. Then there's this female doctor. She saw me. She came, Madam, because I got a referral letter from George Clinic today. Oh, no, you can lie down so that I examine you. So when she was examining me, she said, no, doctor, no, you know what, doctor? This one, no. Like that patient there. Then I just looked at this doctor. She examined me. No, she needs a scan.
Mm-hmm.
And just there, then she did out breast scan. Yes. Then whatever she found, no, she needs a biopsy. Yes. So that's how she gave me the date to go for biopsy. Yes. So I went back home. I just said, no, I won't go back to Levi. Yeah, because the way they attended to me, I said I won't go back to Levi. And for sure, I just went back home and sat.
The reception wasn't good.
Yeah, it was not good at all. Then from there, I started again. I went to UTH.
You changed hospitals?
Yes.
From Levi
With the
to...
referral?
Yes.
With the same referral letter?
I went back to George Clinic. I said, No, I want to go to UTH.
Not Levy.
They refused. No, cancer, whatever it's done at Levy. I said, no, let me try
UTH.
UTH. Since they haven't yet found that I have cancer. This is just a breast where I have this problem. So even when I go to UTH, I won't tell them I have cancer because I don't know if I have cancer or not.
Yes.
So I'm just going to UTH as a patient. That's how I went to UTH. And the girl I found there, she was good. Yeah, she attended to me nicely. She did all the examinations and what. And then she said, you know what, you should go for what? For mammogram. Yes, at Maina Soko. So that's how I went to Maina Soko for mammogram. And then the nurse I found there, the one who was doing the mammogram there, she was nice. She said, these examinations, they take long to be read. So maybe let me introduce you to someone. I'll say you are my aunt. And for sure, she introduced me to one of the doctors, whom she said, she's my aunt. And that doctor was so good.
At UTH?
Dr. Kapembwa. No, we met
at Maina Soko.
At Maina Soko.
Maina Soko.
Okay.
Dr. Kapembwa. So that's how Dr. Kapembwa examined the mammogram, what, and then she said, I should go for biopsy. Then she does the biopsy at same Levy. So she said, okay, I'll give you this day. Yes. Even the day I went, she just squeezed me. When I went there, they refused, but she said, no. Besides, she's a nurse. If we cannot help ourselves in medical fraternal, then who else are we going to help? This woman, we need to help her. And for sure, that's how I was finally called and I entered. They did the biopsy. I went to this lab at Salvation Army.
Which one?
The Salvation Army, just near Salvation Army there.
Sanket.
Not Sanket. Yeah, one of the labs there.
Okay.
That's how I took the biopsy. Then after 3 weeks, I went, I checked, and I found the results. The doctor told me if the results come, just
Bring them.
send the capture and send. I sent. And then she said, you know what, Monica, I'll urge you to go to cancer clinic. So I knew this is cancer now. So that's how I went to cancer clinic there. I gave them the results. And
That's on a different day.
Yeah, those are different days. Yes. I took those things there. I sat down and then they gave me what? A review date. They said, no, the day you come to see the doctor, she gave me the date.
So
I
during
think
that
after 2 weeks or so.
during that period, school-wise, you had already communicated to your school that you're now.
No, by then I haven't communicated.
Okay.
Yes, I haven't yet communicated. So now, after 2 weeks, I went to see the doctors. They saw the results. But for them just to come out and tell me, you are in stage 4, they were like dilly-dallying. I tried, doctor, what stage? Doctor. I went, I came back. I went, I came back. At last, that's when one of the doctors said, now if we tell you that you are in stage 4, what are you going to do? Like, no, what can I do? I just want to know the stage. Because everyone, if someone has cancer, she has to know the stage.
Yes.
Is it in stage 1, 2, 3, or 4? Or no, you are in stage 4. Not okay, fine.
What does stage 4 mean?
Stage 4, it means cancer has spread to other
Parts of the body.
parts of the organs.
Yes.
Yes.
So at that particular point, when it's in stage 4, we can't do a surgery.
So
It's other means. Unless if she was found maybe in stage 1, a surgery is going to be more ideal. So now we have to listen to what followed next. What did the doctors tell you after they told you in stage 4?
So I went for a scan. I was told to go for a scan. In fact, after a scan, that's when they told me the stage. I went for a scan, and then the results scan came. I took them. That's when they said you are in stage 4. And then they said, no, you have to start chemotherapy. Yes. I was not for the idea March to start chemotherapy, but I thought then the same woman, the friend to my
best
twin
friend.
sister, she just told me, Monica, whatever they tell you, just do it. Okay, like my sisters, they didn't want me to do chemo. But afterwards, I just told them, no, I just have to do it. So that's how I started chemotherapy. But then I was just okay, very energetic. Immediately I started chemotherapy. First day, I even fainted when they just put the drug. The drugs are very powerful, very powerful. I fainted. My twin sister and my young sister, the two of them, they are the ones who escorted me there. They called the nurse. The nurse came. She stopped the drip. Then she gave me some other drugs. After some time, I became okay. Then they said, "Do still continue." I said, "Okay, let's continue." They continued until I finished. They just lifted me in the car from the cab to home. How I was sick. Yeah. From that time now, they used just to feed me, they would bath me. Just these basic things they were doing for me, I couldn't do for myself because of the drug. Yes. So like 2 weeks, the time you are like you start feeling much better, again you go back.
How many cycles were you getting in a month?
8 in a month.
Yes, like how many times were you going back to the
3
hospital?
months, every 3 weeks.
Every 3
Every
weeks.
3 weeks.
So maybe in a month you do it once.
1.5 somewhere there. Every 3 weeks, I would go to the hospital. So 2 weeks, you are very ill, sick. The time you start feeling much better, you go back. They put you out. The whole 6 months, now I was back at it. Yes. I finished the 8 sessions. After I finished the 8 sessions, I stayed for six weeks. Then I was told to go for scan again. So when I went for the scan, it came back. They said, because the first scan, it showed at the spine. Yes, there were something on my spine. So when I went back, they said the breast, it has reduced. And then even the patches on the spine, it has started like fading a bit. Yes. So that's how I did what? I sat, I went there, I asked them, okay, now the results are like this. What's the way forward? They told me, stage 4 cannot do anything. I said, doctor, I've seen people in stage 4, their breasts are cut. Why can't you just cut it at enough? We cannot. So that's how I just said, what can I do? Let me go back home. Then I insisted, doctor, okay, you mean I just go home and sit?
At that particular point, you were done with your chemo, or they had given you another treatment?
No, I was done with the chemotherapy.
So after the chemo, there was nothing else to be given to you?
You go home. Then they tell you after 6 weeks, you go for a scan. Then now that's the time I went for review now. Yes. So like the doctor said, no, there's nothing to do. Not really, yes. So I don't know if it's because I insisted much, then this doctor just said, okay, let me take this pill. Take it for 2 months. That's how I went. I got the drug, and then I started taking. It finished because they only give once, just for a month. I go back, I went to collect. Then I went for review. I told the doctor, this is drug I was given for 2 months. Then another doctor, that's the problem, which is there. You don't see like one doctor.
Okay.
It's this review you go, you find this doctor. The other review you find this doctor. So each doctor has their own views.
Oh, how is that? How does that happen? You get to when you're going for review, you get to see different doctors?
Yes,
it will be the same unit. Let's say if this we'll give it like unit E. You're being seen by that unit. So any doctor for that unit will see you because they all have a clear picture about you. And at that particular point, if there's any clarity the person who saw first will inform the other doctor, okay, I want to make a clarification on this one. So because the government sector or these hospitals, they're seeing a lot of people. So they can't be stationed to wait for a specific client. I feel that's why most of the times when the patient comes, they'll see another doctor, but the file will be there. Hence, the doctor has an idea of this patient who has come. And they're going to make any plan, they will consult the person who saw them so that they all move in the same direction.
Okay.
So when I went there, I told them what I was given for 2 months. Then this other doctor said, oh, this drug, you can't take it for 2 months. It's 5 years.
Okay.
5 years. That's
And that drug was given to you for free?
Anastrazole. Yes.
It was given to you for free?
Nima.
Ah, okay.
Nima. We get it under Nima.
Okay.
Yes. So that's how I started taking this drug. When you go for review, your file is lost. They take the file, they put it somewhere. You are just seated waiting. They'll call me Bantuasira. Until you go, you ask, I came a long time ago. My file. File. They started looking for it. Maybe they find it on top of the cupboard. It's here. How did it come? I came. I reported and files are here. Everything. The same procedure which we always do. That's the procedure I followed. So I don't know who got the file and put it there. Then they check. My boy, you came to do what? No, I've come for review. You've come for review. You finished the chemotherapy. Yes, it's just a review. Okay. Just like that. Then they take the file. Maybe they take it to the doctor. Then the doctor just writes, okay, the lab are okay. Labs are so and so and so. Come up, they give you another date to go there. So just so that thing, it really puts me off. So most of the times, at some point, I even stopped going there. For reviews.
You stopped going for review?
Yes, I stopped.
Do you now go for reviews?
No, I don't. But I told this nurse last time I went, I told her, okay, when are the reviews? She told me, I told her frankly, you know what, sister, me, I don't come for reviews. I have a reason why I don't come for reviews. But when I come, when I go to collect the drugs, they will ask me to go to the lab. I do the labs and they check the results.
What was the reason you mentioned why you don't go for reviews?
The same reason. You go there, they lose your file from morning up to whatever time you're just there seated.
In your line of work, you had mentioned that you started as an enrolled nurse.
And then she went to
EN?
Yes, EN, which is a certificate.
Yes, okay. Where you practice. For how many years did you practice? And
I started work in 1997.
In 1997, wow, that's quite over 20 years, eh?
It's a lot.
Yeah, over 20 years. In your line of work, which one was your first post?
At St. Paul's Hospital.
St. Paul.
In Chelenge.
Chelenge, last on the left.
That's where I did even the enrolled nursing, just there at St. Paul's Hospital. I asked in the past, the ODs, when you finish school, like especially the missionaries, what they used to do, the mission hospitals, when you finish school, they would even give you where to post you there and then before the results. Okay. So when the results come, you know where you are going. So I knew that I would be at St. Paul's Hospital. Okay. So when the results came out, I just did the registration and everything, and I started work just there at St. Paul's Hospital.
Interesting. Let's briefly just chat on your experience as a nurse practicing then. And
you can compare it to now.
Since now, yes,
now we talk about you as a patient.
Yeah, and then, you getting frustrated when they lose your file. How was the standard practice then? You've been enrolled. You are working as a nurse. How was the practice then?
Enrolled nurses, even now, when you go in hospitals, when you find an enrolled nurse, maybe she can accept what I'm saying. Maybe you've experienced such. Enrolled nurses, they work. Those are hands-on nurses. They are not paperwork nurses. No, they are hands-on nurses.
Not paperwork nurses.
No.
Women are paperwork nurses.
Registered nurses. They are paperwork nurses.
Really?
Yes.
The Gen Zs.
Maybe
They will
now.
not die.
Oh, maybe now. You know why I'm saying now? Almost everyone now has gone for registered nursing.
Yeah.
So in the past, enrolled nurses, and for sure, those were the nurses in the wards. We were the nurses who were working on the patients. I remember, like in St. Paul's, we had Dr. Mumba. What he used to do when he comes for the rounds, he never used to accept going on rounds with the registered nurse. He would just go, no, sister, I want this one. He would pick the enrolled nurse. Because enrolled nurses, when the doctor do this, we used to do this, and we knew work very much. Because, like I've said, hands-on the nurses. But like our friends, the registered nurse, when they reach in the office, in the ward, they would suit. Their work is timetable.
So who were more during that period? Is it the enrolled nurses who are a lot in the ward, or the registered nurses?
The enrolled nurses.
Then
So meaning the
enrolled nurses.
RNs were the in charges.
Yes. Then yes.
So I think that for me, it's a practical example where we say one has to do the managerial part and the others would do much of the hands-on. Even if they're doing managerial part, I believe, because I equally come from a ward where we got in charges, when she will come work with us in the ward, but when managerial calls again, she'll need to do other managerial duties. So even then, I believe the RN was the...
But she's talking about then.
Yes.
So she's saying
I'm
then
not disputing, eh?
the enrolled ones were more hands-on,
Yes.
Hands-on.
and the RN were more like
more
paper.
of the
Paperwork, okay, managerial work.
Yes.
Like
Not
the way he wants
managerial
to
work.
the way
They
she
were
wants to
just
put
lazy.
it.
In other words, they couldn't.
The way she
Maybe
wants
now,
to put
because
it.
maybe yeah.
Okay, like
Now you can defend them. It's okay.
yeah.
We understand you.
But then can die. Yes, registered nurses were few.
You get that point. That's
Then
the point that I
most
wanted to get
schools
from her.
were
So registered nurses were few, but what enrolled nurses needed
Enrolled
from
nurses
the
were
few,
more.
what enrolled nurses needed from a few registered nurses was them to be hands-on, so that they can also help out with the many work.
So
But you are few as registered nurses, but then you're not visible, you're not seen, you're
The
not.
few, let's say maybe you have one or two in that department. I'll give you an example of BSc nurses right now. We have more of registered nurses and few of BSc nurses. You find that the BSc, probably he or she, they are in charge, or they're the ones holding the managerial position. There are times they'll be called for meetings, what and what, but us, the RNs, will be more in the wards to do much of the work. When that person comes in the managerial part,
who should know most of the work?
all of us, because we're all nurses.
Yeah, but she also gave a good example where when the doctor is doing rounds.
That's
the
what
doctor
I'm
would
saying. That I'm
rather-
not disputing.
Yeah, she's not
Then die.
disputing.
We are just saying the same thing.
Yeah.
We're just saying the same thing. And like this time, you are saying there is BSc,
Unregistered nurses.
BSc, and then there is registered.
Registered nursing,
Right.
because they are phasing away
So,
the EN.
the EN, let's remove it. In fact, it has been phased out. That
Yes.
one, no. So, registered nurses and the degree nurses. So, if you see the way you work and the way the BSc works, it's different. This time around, the RNs, I think, no more than the BSc. BSc, these are direct. Direct, I think they are not doing much like you do.
I'll still dispute.
No. You shouldn't, because then the RNs are the ones who are doing much of
Much
the
of the
hands-on work.
Eh.
And usually the BSc are the ones with
In the
more like
offices.
the paperwork and then doing the supervision, because they feel like they have attained some level of education kind of arrangement. And others went straight to university Others first studied as RNs and then upgraded their studies to.
That's the difference which is there. So even the
Yeah.
node nurses, if you find someone was in node nurse,
And then they
goes
upgrade.
for RN, they are very good.
They are very
Okay.
good.
They are very good. So like even you are registered nurse, you go for degree nursing, you'll be different with someone that goes direct.
Direct, yeah.
That's the thing.
Mhm.
That's the thing.
Mhm.
Mm.
But-
So for how long did you work as a enrolled nurse and
At St.
at
Paul's.
St. Paul's?
St. Paul's Hospital, 1997, I joined the government. Yes. I just worked there for 4 years. 4 years. 97, 98, 99, 2000. I was seconded to UN.
Ah, nice.
Yes. But even there, I went as a general nurse.
Okay.
Mhm.
Yes, in a refugee operation.
What does a general nurse mean when you say you went as a general nurse? What does that mean?
General nurse.
I'm not a nurse, and I understand this better. I don't. So I need to be following
General
the.
nurse is just like any other nurse. They work in the ward. That's a general nurse.
Okay.
Not so tender.
Like like me as a registered nurse, I can work anywhere
Yes.
because I'm a registered nurse. During my training, I learned almost each and everything. So meaning I can work in a pediatric ward, I can work in maternity, I can
Yes,
work in
yes.
gyne, I can work in OPD, I can work in emergency without a specialty. Like I'm just
Mhm.
general.
Mm.
Yeah.
Okay.
Yeah. Then I worked there in UN for 9 years.
In a refugee camp.
Yes. I was the only Zambian nurse there.
Okay.
Yes.
Which
so,
refugee camp is this?
Mange refugee camp in Paracos.
In Borokoso. Okay. Tell us about your experience there.
So I was the only nurse there, and then they were speaking Swahili, French, Lingala, and Tawa. So they were just coming. They never knew Bemba, English, like any other language from Zambia. They didn't know.
Okay. So,
So-
and most of the people in that camp, of course, they were outsiders coming into
Yeah, they were
Zambia.
coming from Congo.
Congo.
Yeah, those were Congolese refugees.
Yes.
Yeah. So now they were speaking just Swahili. And then me, I didn't know Swahili.
Ah.
So I had to learn Swahili
So you speak Swahili.
very much. I had to learn Swahili that I even used to translate when visitors come.
Speak some Swahili for the next 30 seconds.
Like what?
Yeah, you can just say a few words.
Okay, I'm Jambo, Abadi.
Okay. What does that mean?
I'm just saying hi. How are you?
Oh,
Mm.
interesting.
Jambo Kabari.
Mm.
Okay. So you had to learn the language that you interact with those people.
Yes, I learned the language and I learned it very fluent.
Okay.
Yes. So I worked there 9 years. Then we started repatriating the refugees.
Back to their home country.
Yeah, back to Congo.
So that's in 2009 or 2010, somewhere about.
2009, 2008. Yeah, we started repatriating the refugees. But it's not all the refugees went back to Congo. Others, they went on, what do we say? I've forgotten this word. They went to other countries.
Mm.
Yeah,
Mhm.
they were taken to other countries. But others, we took them to Congo.
Congo.
Yeah, it was a very good experience. Such that now I would go with the SS Liemba. You know SS Liemba from Tanzania, that big boat
Ah, no.
where you would carry about 1,000 people plus their luggage, everything. So you start off like we used to start off at 18 hours, the whole night, 06, that's when we would reach Congo.
Mm.
Then we leave them there. Once we leave them there, no other person was allowed to enter the boat. Only us workers. And maybe we'll find that only 4 Zambians and the workers from Tanzania of the boat.
Okay.
Yeah, then would come. So we were like delegates. Yes. Then from there, when I saw that, that this thing is ending, what else can I do? So I applied somewhere in Lopla Foundation as a nurse counselor. Lopla Foundation, it was just a 9 months contract. I did 9 months, but they gave me another year. So I worked there Then again, I saw that things are not working. It's going to an end. I applied somewhere.
This around 2012 or 2013?
I applied to, no, that was, I think, around 2011.
2011.
I went to Corridors of Hope as a senior healthcare provider in Chirondo. I worked. I just thought, not nursing. I just hated not nursing.
How all of a sudden? I thought you loved it.
No, I didn't like it. I went. From there, as I was working, I saw what was happening with not nursing. So I just said, no, this thing should just come to an end. So I went to do Inod midwifery. I did Inod midwifery at Monze, 2012, 2013. I resigned to Corridors of Hope. So when I came, I started.
So you resigned at Corridors of Hope?
I went to school.
To go back to school?
Yes.
Okay.
So I did midwifery. That was 2012, 2013. I came back.
That was a certificate as well?
Yes, it was a certificate. I came back. Again, I didn't have a job. Someone, they wanted a steadiness, TB steadiness at UTH.
You wanted the what?
TB steadiness.
TB steadiness.
Kama organization, just a small Kama organization. Then I went there, I did the interviews, I was picked. I think I worked there less than a year. I saw an advert in the paper, Zambat. They wanted a research nurse in Livingstone. So I applied. When I applied, I was picked. I went there.
You've been lucky,
Yes, as property steadiness. And we were the first one to do property. We were just the four of us. Livingstone, Lusaka, Kitwe, and I'm not sure if it's Sparta. So I worked there for 2 years, 6 years. The contract ended. I finished the project, what I was doing. Yes. It ended from there. Then I was given my money. I went back home. Back home, I sat. Then I saw another advert. In fact, that one is not me who applied. My young sister applied for me, SIDA. It's Swedish International Development Aid. They wanted midwives. Me, I was just home. I just said, oh, that application you forwarded, you've already been picked without interviews. So you are going to such. Come to Kalomo. So that's how I went to Kalomo district, and I was given a clinic in Dundumwezi. I went there to Dundumwezi. I worked just a year. Alone, a nurse, Kanyumba for a nurse, just down there alone. It was very scary.
In Dundumwezi?
Yes. So I worked there just for a year. I just said, no, I can't continue. I resigned.
So you... that's a Swiss SIDA assignment.
Swedish International Development Aid.
Okay.
As a midwife.
Was there power where you were in Dundumwezi?
Now you ask about power.
Yes, because
not even network, my sister. You would go on a hill for you just to communicate. By then,
did you have a family, like husband who needed to
communicate? No, that's why I traveled so much. No husband. Well, which husband can accept such? Honestly, no.
Such traveling,
Because whenever I would go for interviews, they would ask, we want to know this woman. She's traveled a lot. Then they would be saying, no wonder, saying, no wonder. So there in Dundumwezi, my son is the one who just said, Mommy, no, let's go back.
So you abandoned the assignment in Dundumwezi and left?
No, I just resigned. After a year, they renewed my contract. I said, no, I'm not picking it. Yeah, so I stopped. But when I was in Livingstone, I started the public health degree with Creso University. Yeah. So those are the things which are keeping me busy. So even in Dundumwezi, I would be home with my laptop studying. That's the thing which used to keep me busy. Then time of writing the exams, I would ask, I come, I write, then I go back. I just said, no, I've stopped. I stopped. So after I resigned with SID, I came back home. I sat. I sat. Rapla Foundation, they called me again. Now that time, now they called me, they gave me a position of programs officer. Then contract again. There they just terminated my contract. They couldn't renew. I stopped. I sat home. Then
What were you doing in Wapula?
There, it was dealing with the HIV/AIDS programs.
Okay.
So I was spearheading 6 provinces. So I was moving a lot.
Okay.
You see. Then after my contract couldn't be renewed, I went home. I saw another advert with the UNC. UNC. They wanted research nurses. I applied. After I applied, I was called for interviews. I went there. I did the interviews and I was called. I worked for UNC for 2 years plus. I think 2 years, 6 in labor ward UTH. We were doing a research there. So after I finished that, my contract finished in August 2022. Yeah. So from there to date, I haven't worked. Yes.
But you were investing. I want to assume so, because all this traveling and all this organization, there was a lot of investment.
Yeah. And I think it's just a matter of time when you apply, you'll be called upon.
Yes.
The good part is, of course, what we saw most recent, the graduation to what seemingly we are not so much good workers then, the RN. You graduated as a registered nurse, isn't it?
Yes.
Yeah.
I graduated as registered.
As a registered nurse. Okay.
Okay.
At
Defense.
School of
Defense.
Health Sciences.
And then the school you were doing, you mentioned Preso.
St. Paul's Hospital.
Creso. She was doing public health with Creso, then she's taught
Okay.
to go a bridge from EN to RN.
To
That's when
RN.
she can do a bachelor's degree.
Okay.
So like Creso, I'm just remaining with 3 courses, which I'm supposed to finish just for 6 weeks.
Okay.
Then I'll be done again with a degree.
Interesting.
Yes.
Wow.
Yeah, so I think we've heard the story, how you moved. It has been a good journey for you. I feel there are most people there who are looking for jobs. And
They
they've
should just
applied.
keep on applying.
No, you get tired.
Of applying.
Yes.
You don't need to get tired of applying. You just need to keep on applying. I think one of the takeaway is she started as an enrolled nurse, worked in government briefly, went to work at a refugee camp, spent 9 years there, and the rest of the journey in a nursing profession was working with organizations. So there are these organizations always looking out for nurses, either registered nurse, midwives, and everything else. So I think it's also another avenue.
For nurses and other health professions to also look into, not just to wait for the government to deploy.
Yeah, because we have a workload of how many? 29,000 nurses
who are not yet deployed.
waiting to be deployed.
Yes.
So now, which government will deploy all those?
No,
I think you just have to also look into other means. Other avenues.
So now that 2022 you were done, then decided to go to a bridge. So now, I think there's a part where we left you, where you got sick. After you got sick, you're supposed to write. You had 1 course to write. So now, at that particular point, you want to assume you are heading from the school.
After I felt much better after the chemotherapy and the like, because again there's another drug that I'm taking, and Zomita. Zomita is like chemo for bones. So I used to take it every month. So the way they give it, it's 2 years. 1 year you'll be taking it every month. Then the second year you just get four doses. So every 3 months. So I've taken 2 already. So on 19th I'm going for the 3rd. Then the 4th, that one will be done. But for an AstraZeneca, I'll continue that one for 5 years. Yes. So that's one day I just went to see the HOD. At Defense School. I told her that, Madam, I want to write. So the way I went, I was very sick. She said, no, Monica, you cannot write. I insisted. She refused. That's how she said, okay, Monica, go. When you are ready to come, next time when you feel much better, you come. You won't pay anything. The school will cater for everything. So that's how I went. I waited. When I felt much better in July, that's when I went back. No, madam, let me attempt.
July last year or July
Yes,
this
last year. July, this July.
2025.
That's how she said, okay, Monica, are you sure you can write? I said, madam, yes. Because despite being sick, when I feel better, I used to study. Even children used to feel pity for me. No, mommy, not. No. You know, I think when I'm reading, I feel better. I forget other things. I concentrate on the books. So they know I like studying. Most of the times, I like studying. They know. So I was telling them, I'll continue a degree. So, mommy, when you are reading, I think you are happy with that. Just go ahead. Yes. So she accepted. I went, I wrote it, and I passed. I was so happy. And even the school was so happy for me. They were really happy. So she called me. She told me, I said, madam, I'm scared. Monica, no, don't be scared. You've passed. I was so happy. So she insisted for me to go for a graduation ceremony. So when I went there, before she asked, Monica, can we mention your condition? I said, madam, it's okay. You know what I've passed through. So that's how she mentioned. And even in the school, they bought me a stove.
Okay.
Yeah, for endurance and perseverance.
Wow, well done.
Yes, that's what they did. Then I went for graduation. That's when now the Kalembas and the others came now for interviews. I refused. Even Kuba Kalemba, I refused. No. But this boy insisted, no, madam. Then I accepted. Then she posted, and here I am, through Kalemba.
Yes. Yeah.
So you are currently on 2 drugs?
Yes.
Are you taking any, you are also a patient at this point, you're not addressing you as a nurse. We're talking to you as a breast cancer warrior. Are there any other drugs you've taken aside from the ones prescribed from the hospital?
Yes, I won't lie. Yes, I've taken some, the supplements. Yes, I've taken some supplements from some organizations. Then from there, even Greenwood, I've taken something from Greenwood. From there, there's this man we hear now, he gives some drug. It's not like his drug is good. It's not like he says it's no spiritual attack attached to that thing. And he says he's not a witch doctor. But a lot of people go there. There are a lot of people. When I say a lot of people,
is it a traditional drug?
I don't know. But when you get it, I think there are more spices in that thing.
Okay.
There are spices, a lot. You even feel some spices like smelling. Then you don't drink. You just put under here, not under the lip, but here outside between the teeth and the lip. Yeah, you just put there. Just a little. You put. You stay with it for 10 minutes or so. Then you remove. You drink water. But it works. It will work everywhere. Everywhere. Even where you are, it's affected, you even feel it. Like me, it's the left breast. And this hand used to get swollen. Most of the times I used to complain of the hand. Even the children will tell you, please, me, I can't carry this. Me, I can't do this. My hand swollen so. But since I started using that thing, my hand no longer swells. My hand no longer pains. The breast, almost like it almost Kapati wanted to burst. It was so red that anytime it would have, but it's even darkened. Okay. Yes, so that's anyway. I'm not saying go there. People know it's for me myself. I've seen that it has worked for me. Okay. Yes, and I've seen that it's working. Yes, so I make sure that at least I'm with it in the house, because through that I don't even take painkillers. I don't take painkillers.
For how long have you used the same drug?
2 months now.
2 months.
But you still go for your reviews?
At the hospital. Hospital I go.
Okay.
Hospital, even the drug for the hospital, even where I got this drug, they even mentioned that if you're taking another drug, don't stop.
You
Continue.
go to UTH.
But just the timing. Like this one, you can take something after 4 hours of taking it. And they advise to take it in empty stomach. Because you vomit,
Or if you just take it
others
on an empty
diarrhea, the way it has taken. But it's not, I think it's not a big deal.
So how are you doing now? As we're about to wind up, so what's your current situation? How are you doing?
Like health-wise?
Yes, if somebody asks you, Monica, how are you? Like in honesty.
Me, I tell people I'm fine.
Okay.
Because I'm telling you, it's like I don't feel anything paining in me. No. Yes, I've lost weight, but I was trying to Google to see what could be the problem. But somehow I think I've seen a problem where the problem is with my weight loss, the drug I'm taking.
Anything you're currently doing for yourself, because you said from 2022 till now you've not worked for any organization.
The only thing I do like home, I have a small shop. That's the one which is helping me. It's small, it's not big because it's not even registered. So that's the thing I'm doing. Otherwise, there's nothing else I'm doing. And then even my sisters, such a bit, they would help you here and there. You know. Because even them, they have their own
families.
Yes. So when they remember you, they remember you. But when I was sick that time, they really took care of me very much. I can't complain about that. But like what I'm doing, that's what I'm doing.
So now we have quite a number of women affected by breast cancer going through these challenges. What would you say? Because I think when you went to the hospital, you mentioned that the doctor mentioned that your stage, your stage is this the 4th stage? Yeah, and indicating that you were quite late to discover that you have cancer. What is the best approach for women should they do regular, is it called testing or diagnosis or
like,
whatsoever?
Like antenatal, I'm a midwife. During antenatal, we tell the women to be examining their breast. Especially every woman, every month, we do our periods and whatever, they should be checking their breast.
Every month.
Just examine. And if you see anything strange in your breast, you go to the hospital right away.
Is it so much in mothers or even single women?
Everyone. And this breast cancer, let me even mention, even men are having it.
Men, how?
Yes. A man having breast cancer, they are there. At cancer disease, they are there. I'm telling you.
It's like a rubber.
So
It's you to check.
me have come across one. Breast cancer in man. So you would like, what happened? So it's really, I don't know, this cancer, we don't really know where it's coming from. So like even me, in my family, there's no history at all.
Is that so?
Yes, but I'm found. Yeah. But another thing, I'm telling you, they'll tell you have this disease. Just be firm, accept, and have faith with God. That's the only thing. That's when you can stay. Because if you become like you'll be depressed and depression kills.
Yeah.
So with me, I've just received it with all my heart, and I would even encourage other people there. Anything strange on your body, please go to the hospital. I'm not saying go straight to cancer clinic. No, go to the hospital. Then the hospital will tell you, do this, until they come out with what? A diagnosis. Otherwise, don't fear whatever doctors say, nurses say, the attitude they have towards the patients and what. You as a patient, just be humble. Because even me, when I go there, they don't even know that I'm a nurse. But I would just be there, observing what
What's the
they're doing.
attitude of other nurses?
Nurses, as nurses, we have, it's not everyone, but we have some attitudes. So You just observe, you sit quietly, then at last you be attended to. Me, I don't mention. I'm a nurse. I just look at them. I finish, then I go.
You go. Yeah, because as a patient, if you decide to be impatient, you
lose out.
You lose out. You
Yes.
say, these nurses are not attending
Because
to
that
me.
they are not considering you as a nurse. They are considering you as a
As a
patient.
patient.
So we go there, even other people. If you are a nurse, a doctor, when you go to the hospital, that time you are not a nurse, you are not a doctor, you are not one.
Yeah,
You
the
are
patient.
a patient. So be patient with it, whatever is happening there.
Yeah, because I believe you understand very well what goes on to the hospital. Sometimes it comes with triaging system.
Yes.
There's one who's going to come more critical, who can't walk, who just needs the immediate care. So there might be other people who are on the line, but because the nurses have triaged and they've seen that this one, if we don't attend to them right now, we might lose a life. But the others, they've been able to chat, they've been taking juice. So we will prioritize the one who's this life we can lose it if we take forever. So they'll take in that patient, and then the ones that say, okay, sensabwela kudara manje, then wapeleka uwi, because then they don't understand what you've just done there. So they'll cause chaos. But like you said, as a patient, you need to be so patient.
But when I go there, I really admire Madinus. In my prayer, it's at least one day I touch a patient in that white uniform. That's my
What
prayer.
uniforms were you wearing?
White and blue. Cape
Cape with the color.
with 2 lines.
Oh,
yes.
so you want it now?
This time it's a white cape, a plain cape. That's really what I wanted. Yeah. But imagine, my passion is for the patient, just from the word go. Because even when I'm there at cancer clinic, I see maybe someone fails to put up a child. It's like maybe I even go and ask, can I help? Now, if I say, can I help? But mind, I really feel bad.
Yeah.
Something that I can do, but I'm unable to tell them that, can I help? If there was a way, even volunteering, I can volunteer that side.
Okay.
I'm telling you, I can volunteer that side.
Yeah. So
I know I'm good in some things that I see there.
Okay. Yeah, I believe every nurse is very good at one thing or
Yes,
another. Like with this one, everyone can say, this part, I am a legend. This part, yes, but sometimes I don't do well, but I am also a legend.
But they used to come even, like in Kashkish, they would fail the babies. They would go and call Monica. In the night, I would go. No vein seen, but anatomically, I would just hear. You can get a child, blood. That one.
Okay, now that you've breathed, you are now an RN and you're going through a different tour. What weights do you have? I know that the student is out there who's thinking of giving up because they've gone through a lot in life. Like you said, you failed and then you had one course and then the sickness came in, which gave you a different tour on life. What advice would you give a young student nurse or somebody out there who's watching? Probably they might be sick as well. They might be battling up different issues with their lives. What advice do you have for them so they don't give up? They can also attain what they want to be. Like you said, you've always wanted to wear white without the blue line on your cape. What advice do you have for such a one out there who's watching us today and who feels like, okay, my life is done, I can no longer do this, I want to give up? What would you tell them?
The advice I would tell them is not to give up, just to stand firm. Whatever you are going through, it's ladder. Every person has ladder. You know what? Every person has ladder. And what our parents went through, that's not what we'll go through. Each one has a ladder. One time, things will be okay. So they just have to be firm. A young lady there, whatever they are doing, this time around, school is education. You say you stop education, you are nothing. Many, they want to marry someone who's working. Women, they want to marry someone who's working. Now, if you give up, where will you be? So the thing that I'm saying is just to be fair. And for the patients, even them, they shouldn't give up. Be faithful. God first. Whatever you do, put God first. Me, I've never forgotten God. And I know, like, God, I know God is good. And God is so merciful, I'm telling you. Without God,
keeps on showing us his undeserved kindness.
Mr. Kalawa, how much do you believe in God?
100%.
Okay, I think we'll have that conversation away from here. Madam Monica, it was so lovely to have you and to be able to share your story with the rest of our viewers. Tell them about your journey about breast cancer. We believe every woman out there needs to do a breast cancer examination or breast cancer checkups. And like right now, different hospitals are offering cervical cancer screening and breast cancer. You can do it for breast cancer screening, you can go to Levi Manaus or different hospitals. You can also examine yourself at home. Like she mentioned, you can do it every day on your own. If you notice anything unusual, report it. Go to the hospital, nearest clinic, so they may see it and then they might tell you what it is, and you might be treated faster than they've had it in the last stages.
So you do the breast cancer testing on your own, not by
you can
a male
still
doctor?
examine yourself
not
at
testing,
home.
but examining.
Examine.
You can examine yourself at home. And for those who are married and their husbands can still do it on their behalf.
Then those ones who are not married?
They do it on their own.
Themselves.
I thought doctors should enjoy that privilege.
What do you mean?
They are the rightful people
You
to...
go there for your monthly ones. You can go to the hospital now. That would be your checkup. Like doing other checkups, you go to the hospital. Then you can also say, okay, I want to do cervical cancer screening. I also want to do breast examination. They'll do that. But for your everyday checkups, you can do that on your own at home, from the bathroom. Or before going to the bathroom, you can still examine yourself.
Yeah. So there you have it. Keep on examining yourself so that we reduce and you also detect those early signs of breast cancer. You've read it for yourself. Even in Maine, it's showing now. So none of us is exempted, or none of us is free from this condition. So it's better to be aware so that we prevent any other future disturbances. Yeah, we need to have a very good health condition so that we keep on functioning well. Madam Monica, thank you for joining us. Tenda enjoyed this show.
Yes, I did.
Yeah, because she's a registered nurse. Yeah.
Don't worry, we'll fit you in.
Yeah, so thank you very much for watching. Remember, this Smart Podcast is brought to you by Elitrasmart Medical Supplies Limited, your #1 healthcare provider. Thank you for watching.